Now, the last Ebola patient was Dr. Craig Spencer, who was released from a New York hospital free of the virus. Hospitals, though, are still stepping up its efforts to be ready. Roza Kazan has more.
Business is booming at a Medline healthcare supply plant in Illinois, about an hour north of Chicago, as hospitals across the United States brace for potential Ebola cases.
The first stage, they're putting together the coverall, the bio bag, and the eye shield.
It's called Personal Protective Equipment, or PPE. Items the U.S. Center for Disease Control and Prevention recommend that healthcare workers use when dealing with suspected or confirmed Ebola patients.
Inside, we have a coverall, which is a full body suit that also includes a hood as well as boot covers.
The specialized kit designed with Ebola in mind also includes a face shield, a respirator, 2 pairs of gloves, a bonnet, and a hand sanitizer. Medline had this production line up and running within 1 week after the lethal Ebola case in Dallas, responding, they said, to a flood of customer inquiries.
Since the first case was discovered in the United States, our inquiries per day grew to over 200 on personal protective equipment.
Before, a typical day might have brought 30 inquiries. And Medline says demand for its products soared in October, 40% for facial protection items and more than 50% for full-body products.
Got to be 4 inches to half an inch above your eyebrows.
University of Chicago Medicine is one of 4 hospitals in Chicago designated to treat potential Ebola patients. They've had to order more shrouds and face shields and test the equipment they already had.
We took gowns and we laid them over the garbage can and poured liquid on it and waited 15 minutes to actually soak through, things like that.
These patients can get horrible diarrhea, and they can also have hemorrhaging episodes too.
And that's why all protective gear must be fluid resistant.
You really don't want those fluids to penetrate your personal protective equipment. Fluids out, you safe inside.
8 out of 9 Ebola patients treated in the U.S. have survived, a stark contrast to the near 70% death rate reported out of West Africa, where the virus has killed more than 5,000 people. But experts say the danger in the U.S. remains real.
What I tell everybody is that we just need to be ready. One patient is important enough to be ready.
Roza Kazan, CCTV, Chicago.